And we are live. Good afternoon, good morning, or good evening, depending on when and where you're watching the show. This is the Healthcare Show with Marion Trish Carr. That's me. I'm your host. And I'm so excited to have a repeat guest on my show, April Mills. April was on one of the very early shows of the Healthcare Leadership Show, and I'm glad to have her back today. If you're watching live, we'd love to let you or watch the replay. Please let us know in the comments. Let us know that you're there and where you're watching from, because the whole idea of this show is to be interactive, sharing these great thought leaders that are in my network with my network and beyond. And today's topic is one that really hits home with me. For those of you who might not know me, I work in the area of executive search, business development, and leadership development in the world of healthcare. I've done that for 35 years. And today's topic is why healthcare heroes fix pain everywhere except their own organizations. April, thank you for coming on the show again. Glad to have you. You're one of my favorite people to be on the show, and you and I have been connected for a while. Please introduce yourself further, but love to jump into the topic. April, thanks for coming on board.
Thanks so much for having me. Hi, everybody. My name's April Mills. I'm the founder and CEO of a boutique consultancy called Engine for Change. We call it the bureaucracy hacking company, where we help organizations deal with the rate of change and how to respond to it. And so to treat that organizational pain, we're going to talk about today. My background's in engineering, but I've been doing corporate and organizational change for many years. And healthcare is a passion because I have 4 children, one with severe special needs. And so I've just been a connoisseur of the healthcare system for many years, appreciating the hard work so many people do and the challenges that they face.
Yeah, that's one of the things you and I have talked about quite a bit over the years, and we connected through the Recognized Expert program and Dory Clark's program. And one of the things that you and I hit it off immediately is this is your personal experience as the navigator for your son's care and the challenges you've seen. And when she says she's an engineer, y'all, she's a nuclear engineer. So she's got this incredible background and brilliance that she brings to the table. And you and I had planned on having this conversation for a while. And the title is Why Healthcare Heroes Fix Pain Everywhere Except Their Own Organizations, which I mentioned earlier. And this title of the session really provokes the question to be answered. Why do healthcare heroes, particularly leaders, fix pain everywhere? They take care of their patients. They take care of the people that they serve. They work toward bringing the best care delivery to the population, to the people that come through their walls, but they really struggle in solving the pain and issues in their own organizations. And I would love for you to talk about how you see that problem, and then we will jump into the solutions. If you're watching live, let us know, or watching the replay, let us know in the comments where you're watching. April, what are your thoughts?
Yeah, I think one of the challenges that they have is they've never been trained in how to triage, diagnose, and treat the pain in organizations. And when we face a challenging situation, we tend to fall back on the strengths we've been trained in, right? So if I don't know how to deal with my own personal burnout or my frustration with a new corporate change in the healthcare system I'm in, I hunker down and focus on my patients. But it sends the wrong message as you get frustrated and burnout and living with that pain when you're trying to then counsel a patient to be proactive and deal with theirs. Now, what the patient has that maybe people in healthcare haven't had until now in this conversation is somebody to come alongside them and help them heal that pain. But that's why we're so passionate about having this conversation, right, Marion, is to help people realize if you're in the healthcare space, your pain is treatable. And there are simple tactics you can use to have more energy, enthusiasm, and passion and pain-free days at work.
one of the things that we've talked about before, April, and one of the things that continues to almost be replete throughout the organization. And for again, for those of you who don't know the work that I do, I work with healthcare organizations of all sizes across the United States and a couple of international companies. And one of the things that we saw during the pandemic was a light being shined on burnout with physicians, with clinical providers, but also with leaders. And there was this, I've shared this before. I think a lot of leadership skills or a lot of leadership skill sets were exposed. And some of it is related to this idea of burnout within their own ranks. And, April, you're a nuclear engineer, which we talked about, in a tech industry change accelerator. I mean, that's the work that you're doing. But what got you interested in the pain points of healthcare organizations? Can you talk a little bit about kind of why that became such a key piece? We mentioned earlier that you take care of your navigator for your son, but talk a little bit more about like what got you, I guess, fired up about this particular area of work.
Yeah, so it was from dealing with my son and his health challenges. So Ted's 18 now, but he was born with spina bifida. So lots of complications. He's had over 40 surgeries. He also has dealt with a year of chemotherapy for a glioma in his spinal cord and his neck. So we've had a host of challenges. And what I noticed as we were trying to navigate all of that was so many of the delays and frustrations in these organizations could be managed if the providers had some of these, what I call change agent skills, taught to them. And so one specific story that really highlights what you can do when you apply these to the challenges was, it was during COVID. I was in Wisconsin, where I'm from, with my children for a vacation to visit their grandparents. And we realized my son needed a spinal cord surgery. His nerves were fraying as he was growing, and he needed an untethering surgery. Now, typically this takes months to get scheduled, right? Getting through all of the pre-op appointments, confirming it, getting the surgery time. But I was on the phone with his surgeon on a Thursday. He said, actually, we had a cancellation in the OR on Monday, but you're in Wisconsin. We're here outside of Seattle. How are we going to make this work? And being a results accelerator who understands those organizational challenges, I said, I've got a plan. So we had the pre-op imaging sent to the local hospital. We got a coordination plan to get the right phone calls at the right times and got the kids in the car. My friend actually flew out from Seattle, met her that night in Minneapolis, and we drove through the night, a bit like the Amazing Race, but to get him to his hospital appointment so we could get to Washington by Saturday, so he could actually get a COVID test on Saturday, so he could have surgery on Monday. And so what usually takes months, because I applied my learning of the systems and understanding of these tactics, we got done in 3.5 days. My son got the procedure he wanted. The surgeon got to meet his needs quickly. The hospital got to use that OR time, which might have gone unused. And so everybody benefited. And that's just, I think, a great example of how fast you can go if you understand how to hack the bureaucracy and deliver that value.
And, there's so many people that have gotten involved in the world of healthcare delivery change for a lot of the same reasons. That driver of you seeing it firsthand, having to work through the process, having to do the things that you just talked about. And I think about for the average worker who's in the marketplace working in healthcare right now, sometimes they get disconnected from that. They see the patient that they're dealing with, or they might even interact with the family while they're in their organization. Why? And I know we're going a little bit off of what you and I talked about, but I think this is an important part of the conversation. Is they see you in the context of that experience, that you're right there. But a lot of times healthcare leaders don't see all the stuff you had to do just to get to them, just to get the patient in front of them. And I think that's also somewhat similar to how leaders in organizations are so focused on revenue, so focused on patient delivery quality, that they are missing these key pieces of burnout, and the impact that's having on their workforce, and the impact it's having. My point is, and the question is, why do we, and I'm going to use me, is that why do we get so blinded by the work that we're doing at the moment that we miss out on the long-term issues, the challenges, the burnout, the challenge? And then how do we show clarity around, or get more clear? That's the better question. How do we get more clear as leaders to see the bigger picture, and talk about that from the perspective of the work you're doing? And that was a long description to a short question, so please forgive me on that.
No, I love it. So you're right. In the moment, we try to focus on where I can put my attention and what I think I can control. What I work with in my work is helping people realize how much more control they have of the options around them. So I work with people, I call them change agents, folks who have decided I am willing and capable to make a change happen. And I teach them something called the change agent's motto. And it says, I will do what I can with what I have where I am. And in that motto, what it encourages folks to do, whether they're a clinician or a senior healthcare system leader, is to look more broadly at what are my options in this moment to make a bigger difference. So you're right, most times that lack of time to do things shrinks their attention. What the change agent's motto does is help open that aperture back up, to give them more options, to see more possibilities in front of them. And then as we practice those techniques and other tactics that I teach and share in my books, is what they uncover is a lot more opportunities to eliminate frustrations, big frustrations and small frustrations. I used to work at Intel Corporation, the chip maker, and the former CEO of Intel, Pat Gelsinger, used to say, burnout isn't hours worked, burnout is hours frustrated. Because if it's your passion, you've probably had weeks you worked a ton of hours and you were energized at the end of the week. But it's those hours frustrated. And those hours frustrated perpetuate if you don't think you have the agency to change the frustration. And so that's really the key that helps unlock possibilities for leaders, for clinicians, for administrative staff, is the notion of you actually have a lot more agency to make change happen, to shape the change happening to you, and to drive down. If you were to do one metric, anybody can do this in their week. How many hours was I frustrated? And then what can I do to limit the hours frustrated? Some might be avoidance, just like you would tell a patient. But a lot of times you have to work through the frustration, through that pain point, right? Stretch past that discomfort. And you can do that using these, what I call change tactics.
And I love that idea of looking at what percentage of our week were we frustrated. And it speaks to, you and I have talked about this in the work that I do around applying flow theory, Csikszentmihalyi's work around flow state. One of the things he points out is when we're not in a flow state, when we're not fully engaged in what we're doing, we're getting value from the experience, we're losing all track of time, we feel like we have command and control over the experience, etc. We're either in a state of boredom. He talks about we're in a state of boredom or apathy. Performance obviously drops in that capacity. Or we're in a state of anxiety or stress or conflict and or frustration, to use your word. And I think that's so on point around identifying what are those frustrations, what are the challenges there. What's another technique that you teach the leaders that you work with to address this concern that we're talking about?
Well, one of the key things, especially if you're in a senior leadership role, is to also look at how much am I doing what I call driving people, which is using your authority to compel others to change. And how much am I driving change, which is choosing a change for myself and clearing the obstacles for others to choose it too. Because you could make a list of the 5 top changes you're trying to drive in your organization, you're trying to make happen.
Mhm.
You might be the cause of your own and other people's burnout if you're just shoving on that change, thinking that's the best way to get it to move.
Mhm.
But a simple tactic change of moving from this is mandatory, you all have to be here or else, to this is urgent, I'm going to be there. I invite you all to join me. And I want you to feel as motivated to be there as I am. Now you don't have to make it mandatory, that notion of I have to go. Now there's a
Mhm.
curiosity. Well, if the boss is so fired up, right? FOMO, fear of missing out, kicks in. Now I've got to go
Yeah.
see what's different, what's going on here. And that energy is contagious. And then you get curious. You know, I'm really excited to have you here with me. What's stopping you from joining me more often? And this is the same things you can also use with patients. What's the limiting factor? Why, you know, we talked about we both want to be here, but what's stopping you from getting there? What am I missing? And that's the accessibility piece that being my son's mother has taught me too, is a lot of barriers to progress are
Mhm.
hiding in plain sight. Just spend a week in a wheelchair and you will find every bump in your house and community that prevents you from getting where you want to go. And it's the same thing in organizations. Those with authority often walk past barriers that are impossible for others to cross.
Mhm.
So, huge opportunities to bring that energy.
That's such a good point, and I interrupted you, but that's such a good point about how leaders are often because they have entree, they have access, they have can pass barriers to use your description that they miss out on what is their followers capacity for that, right? Like missing out on that. April, one of the things that you and I've talked about before is the fact that leaders need to also not just be focused on the care and well-being of their organization, which is what the whole topic is about, but so many leaders that I've worked with, particularly in the last 10 years, they're they struggle taking care of themselves.
Mhm.
What are some for those hardened, I'm a I'm a strong leader type that really, nothing bothers me when deep down inside those challenges really are taking place. What is some things they need to think about themselves in terms of their own burnout and their own place within this issue? And I guess the follow-up is what are some things they need to do to change that for themselves?
Yeah, great question. And I think this applies whether you're a leader or a caregiver like I've
Mm,
been. I've been in both of those roles. I think a lot of the mechanisms of it are the same. The notion of if not me, who can
mhm,
often become I have to or else. And that's a very different energy to give to anything. So rather than admitting our limits, we say, but it has to happen. So it has to be me. And we push past uh, pain thresholds, exhaustion thresholds, often to, catastrophic failure conditions. There's almost a badge of pride to work yourself to the point of that true breaking point, whether it's in your health or your mental health or your relationships. And what I work with folks on is if you can see that horizon coming and you don't want that to be your story, there are
mhm,
other tactics. And one of the simplest ones is to give yourself some grace and appreciate the fact that your team probably can carry a lot more if you all weren't sort of handing rocks to each other of have tos. well, you have to do this as the leader, and you have to do this as a clinician, you have to do this as the admin. But what can we choose to get to do together? And what burdens are we all carrying that we could set aside? And that's why this powerful change from driving people to driving change usually has such a profound effect on leaders and their organizations. You can have the same goals, but how you approach them drastically shifts, and the energy just springboards back. And then you just feed off of that newfound resurgence. And it's amazing to see. I get almost tongue-tied thinking about it and talking about it, because it motivates me so much to see that moment, much like I'm sure for clinicians, to see that breakthrough and change of, somebody leaving in pain and coming back in comfort. That's it. I can see why the practice is powerful, right? To be able to give those moments to people is amazing.
Yeah, I love that answer, and checking in, and thank you. We were struggling seeing some of the comments in the platform, but Dr. Rebecca Swain is checking in from DC and is really shared in the conversation. When you get a chance to check out those comments, Dr. Swain, thank you for joining us and sharing your information. Jennifer Fessler, Dr. Fessler is checking in from Oklahoma, and one of the comments that she made is so often perfect become the energy of good, right? We are so focused on the optimal solution, what we could do if everything worked right. We become so exhausted to flex on what we could do in the time, space, and resources we have in the constraints at that moment. So focusing on perfection as opposed to being good. Thank you for that. Felipe is checking in. Felipe is part of the Workplace Wellness Coalition, and just a great guy. He's checking in, and he's watching from snowy DC today. And Karen Power, one of my favorite HR professionals, is checking in from Charlotte, North Carolina, and someone I've known for years. And thanks for being here, Karen. She made a comment that I wanted to share. Focus is a key element here. Many competing initiatives and goals, very little assessment around organizational capacity and the fortitude to truly prioritize. Leaders struggle to focus, and that impacts everyone that they lead and influence. April, I'd love for you to speak to that piece around leaders failing to focus on the problem, because Karen's nailing it with that particular comment.
Yeah, well, and that it becomes a matter of the layering as well. So there might be my list as a leader of what initiatives I'm driving, but that's usually not the exhaustive list that someone in the organization is facing. They have that top leaders list, which might look reasonable from there. And then they have their bosses list. Maybe they've got caregiving duties outside of work. And what you start to get is the overload often is personal and specific. And so at all of those levels, it's about getting curious about setting the priority order maybe, but saying now how far into this can we get with who we've got? One of the key things I find in most organizations is we go back to the same usual suspects over and over again to make change happen. And there might be somebody who's junior in their career, who's really eager to get involved. And we say, wait your turn. Or there's somebody who's late in their career and they're on 7 initiatives plus their day job, and they're just burned out and frustrated by the fact that it seems like nobody else carries any of this extra load. So I have tactics I work with organizations on to find more change agents, to train more change agents so that more of that load can be spread around. And then we also teach them how to prioritize from where they're at and help their leaders prioritize too. Because there's no fixed capacity for change. It's very dynamic. Sometimes the tactics drain us. Sometimes the situations drain us. And I try and teach people both that resiliency personally and that resiliency organizationally, so they can both handle more change and respond faster, even if maybe conditions don't let you focus down to just one or a few things at a time.
The thing that always strikes me when I go into an organization, and the work that I do, again, is more on the side of the executive search side or leadership structure, we are currently doing a big research project, scaling and growing our work around gratitude as a leadership acumen, and validating it in a lot of different platforms and in relationships. But one of the biggest things that I see, April, is that often and Karen's talking about it in the chat, is the leaders' own behaviors tend to skew the how they're messaging the people around them. And so when you walk into an organization, April, when they bring you in to help address these problems, or have an awareness that, well, we need to talk to you, what are some of the things that you do with those leaders first to figure out where they are in this whole thing? Because I think that's, again, it's not a top down, we need everybody. You talked about everybody earlier, but I guess, how do you assess what their need is as opposed to what they think their need is? Maybe that's the better question.
Yeah. So it's a lot like what I'm sure any, clinician would have faced, which is those basic interview questions to get sort of the state, that current state, trying to understand what initiatives do you have in flight that you've launched, that you're working on with your team? What are some of the changes that are being imposed on you? I'm listening for how, not only the list, but how they describe them, right? The language they use, the body language they use, the emotions. I'm sure you've talked to somebody about something, and if they're really excited, their voice goes up. Other times it's like they'll go, oh, well, let's see, there's this initiative. Like the whole tone and body language is one of already exhausted and burnt out. So I'm watching sort of in those multiple dimensions, not just on a scale from 1 to 10, how you feeling about this or that. And then I'm seeking to understand or shadow meetings and structures to say, okay, when you're trying to work with other people, what are some of the tactics you're using to get that to happen? So you could think of it like a range of motion test to say, okay, in this situation, how far do you go? Where do you go? How do you bend or not to the conditions? And so from that, then I can say, well, based on these different observations, I think here are some tactics you could use right away. I like to think about it as trying to give somebody something immediate they can do. And then from there, we can do more holistic or long-term things. That's why I wasn't joking when I said it really does model the clinical service. It's a lot of that triage, diagnose and treat. It's the same sort of flow. You froze on me for a minute there. I think I'm back.
Yeah, we froze. Yeah, that's that's the challenge with live. For those of you who are watching, we had a big ice storm here in the mountains of Georgia this past weekend, and they're still doing repair work on the line, so we may have gotten cut off there for just a moment. But I caught the majority of your answer there, April. I knew every time you and I do this is our second show, it goes by super fast. So we're almost done here time wise. Who needs to connect with you, and how should they connect with you, April? Because we want to get you in front of these organizations. Talk about that a little bit, because we want these organizations, we want organization to healthcare to change. And that's your whole company, that your whole company is focused on this level of. How can they connect with you, April?
So they can either connect with me on LinkedIn. That K in my name, I stand out. If you go April K Mills, I typically come up, CEO and founder of Engine for Change. And there's hyphens in that, engine-for-change. And you can also get me at email, april@engine-for-change with hyphens, engine-for-change.com. And so would love to connect, start a conversation. The suffering can be treated. It is real, but it doesn't have to stay at the forefront. I'd really love to help folks so that they can continue to serve and support their patients. It's so needed today. There's not enough great healthcare workers out there to serve everybody's needs. And so I consider it a personal passion project to keep you running well so that you can continue to serve folks that desperately need you, like my son.
Well, thank you for being on the show, April. And I put your LinkedIn in the comment, the LinkedIn link to your page in the comments. And I will welcome my network to connect with April if you're not already part of her circle and part of her network. April, you and I talked pre-show that I'm going to have you back on later in the spring, and I would love to have you back and to go even deeper. One of the things I'd like, maybe we could even talk about is a a case study or something that you could share that might add even more weight to the discussion. So think about that. And any last comments? And by the way, for those of you who are watching either the replay or watching live, shout out to Felipe and to Karen and everyone that joined us today. Last comments, April. Anything that I guess give us your leave behind. What do the leaders need to do right now? What can they go do right now as soon as they get off the show that would start the process?
So the title of my book, my first book, is actually one of my mantras, and it's everyone is a change agent. And so if you don't think you have the power or the capability to create the change you need to solve your burnout or drive the results you want, let me be the one to tell you do. You have that capability inside you. I'm happy to come alongside with some tactics you can use. So you can check out Everyone's a Change Agent on Amazon. Reach out to me. Do not suffer. There is a solution.
Well, April, thank you for being such a part of my circle of network, and thank you for being my friend. And you and I are going to be looking for ways to work together in the organizations that we serve. So thank you for being on the show. Thank you all for watching the Healthcare Show with Marion Spears Carr. I will be back next Tuesday with another episode. I have Todd Dunn, the CEO of Acuren Medical, going to join us. April, have a great day. Have a great Tuesday. Stay warm out there, and we will talk again soon.
Awesome. Thanks, everybody.
And we're off.